This video will provide the definition of a behavior therapy and will explain 3 examples of behavior therapies, which are systematic desensitization, aversion therapy, and functional analytic psychotherapy. Now first, according to the American Psychological Association, a behavior therapy is a form of psychotherapy that applies the principles of learning, operant conditioning, and classical conditioning to eliminate symptoms and modify ineffective or maladaptive patterns of behavior. Now, unlike the psychoanalytic theories, in behavior therapy, the focus is strictly on outward behavior that can be observable and measurable. The assessment phase consists of understanding 4 aspects: the stimulus or stimuli, the organism itself, meaning that behavior therapy doesn't only work with humans, it actually can happen to animals as well. You can do this with animals. The organism's response, and lastly, the consequences. To define these aspects a little bit further, the first one, like I just said, is the stimulus. The stimulus is the external condition or trigger that causes the behavior. Number 2, the organism. Now, this is more concerned on not necessarily with the outer behavior, but rather the circumstances of the organism itself. So for example, what might happen is an internal response, so increased heart rate. Step 3 is the response. Now the response would obviously be the organism's outward behavior, what can be detected and identified. And lastly is the consequences, which is the results of the behavior. In systematic desensitization, the goal is to increase the organism's self-control. It's mainly used for treating anxiety, phobias, as it's not effective in treating severe mental disorders such as schizophrenia and depression. Joe Nash, who used to be a lecturer in mental health at the University of Sheffield for about 10 years, details the 3 necessary steps for systematic desensitization, which I will show now on the following slide. Step 1. The client learns relaxation techniques that will counter the response to the aversive stimulus. 2. The therapist and client collaborate to produce a hierarchy of the client's intensity of response to the stimulus at different levels of exposure to the stimulus. 3. The client is desensitized to the stimulus through systematically graded exposure to the stimulus and practices relaxation techniques to counter the aversive fight-flight response during the exposure. Now, these 3 phases are practiced over several sessions, so not just once, and that's it. And homework may also be given to maintain the counter-conditioning between sessions. Aversion therapy is based on classical conditioning, and its primary objective is to remove an unhealthy or negatively affecting behavior by pairing it with an unpleasant sound, smell, feeling, image, etc. It has helped people quit smoking, although mostly in the short term. And research for this is mixed, and many doctors don't recommend it as the first approach that a person should take, partially because it's believed that once the person is outside the office, the aversion is harder to maintain. Lastly, we have functional analytic psychotherapy. This is an interpersonal approach with a focus on clinically relevant behavior. So this is how it goes. At the start, the client states his or her best self, deepest desires, ambitions, and so on. Then, alongside the therapist, he or she works on the clinically relevant behavior, which hinders what he or she aspires to be. So this is supposed to be a hurdle that should be removed. And then replaces it with adaptive behavior that will help them become the person that he or she wants to be. Of course, the therapist must be sincere, understanding, and caring, and form an authentic and mutually vulnerable therapeutic relationship with the client while looking for his or her clinically relevant behavior as it occurs. And this is the key word here. Of course, let's say if you get a personal trainer for exercising, you wouldn't want the personal trainer to just look for mistakes that you've done or look at your progress in between workouts. For sure, you would want the personal trainer to look at you during the workout and to motivate you and to give you tips on how to perfect your form in certain exercises and so on. What this type of therapist has over other therapists as an advantage is that the therapist would be noticing the clinically relevant behavior inside the office instead of trying to write a diagnosis that could only be applied outside of the office. I hope that made sense. Have a great day.